Good evening, Los Angeles. A year ago this week, the first recorded case of a new coronavirus hit Los Angeles County. 1 year ago this week. It seemed like something very distant, something we didn't really expect to land on our shores. Sure, we had seen epidemics and similar diseases in other places in years and even decades past, but I think we all felt that maybe it was just something that happened elsewhere, not here in Los Angeles. Few of us could have imagined what lay ahead. We didn't have the word COVID in our vocabulary. This virus didn't even have a name yet. People were still going to the movie theater, seeing the Lakers and Clippers play at Staples Center. In fact, it was about a year ago we all gathered outside Staples Center to mourn the loss of one of our great Angelinos, Kobe Bryant and Gigi and the others in that tragedy. Since that day, we've seen everything change. Our lives, our city, our economy, our health. And today, almost all of us have experienced the loss and the grief and the confusion of this year. There are very few of us who no longer have a loved one or somebody who's a work colleague or fellow classmate who's lost somebody in their family to this COVID-19. But since that time, we've also been part of a historic moment in our cities and our world's response to this moment, to these crises, to this pandemic. Each day brings new pain, but also new hope. I know how exhausted we are. I know how hopeful we are. But tonight, as I've done nearly 100 times in the past year, I'm here to share with you that information you need most to help you get through today and tomorrow and next week and the rest of this crisis until one day we can look backward in the rearview mirror and say that was something we lived through and survived. Let's start with the issue that's most on your mind today, vaccinations. As of today, the city of Los Angeles has vaccinated 152,612 people at our 5 city-run vaccination sites as part of hundreds of thousands of vaccinations across LA County. In the last 3 days, our centers have provided 34,850 people with their first doses, a 17% increase just since last week. But as I will say in probably every briefing until this crisis is done, we don't have enough vaccines. We don't have enough vaccines. I understand some of that is the breakneck speed with which these vaccines have come to market, production issues, but I will never let logistics be the excuse for us not getting these vaccines to you as quickly as possible. And I'm spending every day with our team and with our amazing partners to ensure we get more vaccines to more people more quickly who need them. Our capacity keeps growing, but while capacity is good, it means nothing without the supply. And I'll never stop being loud in terms of making sure LA gets its fair share of vaccines and that we do everything to help people get more vaccines here. When we receive more supply of the vaccine, we're ready. At our Dodger Stadium site, the largest in the country, perhaps in the world, at full capacity, we can vaccinate at least 12,000 people each day at that site alone. And our fire department, as is the county fire department and some of our regional partners, are already looking at where the next sites should open up when that supply comes, preparing the logistics and talking to our partners to make sure we know how to get vaccines close to you. And when we get vaccines, we're getting them into arms quickly. Today, the city has distributed 81% of the doses that we have received. This number is among the highest in the country, higher than many of our peer cities, and something I'm very proud of. It's something you should demand at every level of government. Every American, every world citizen should know as soon as you get vaccines, it should be a matter of just a couple days before they go from a factory into somebody's arms. And I've witnessed how we're doing this firsthand, working long shifts alongside everyday heroes at Dodger Stadium, already 6 of those days. I've seen on the line the humor, the courage, the humanity, the can-do spirit of folks who rain won't stop and cold days won't stop and bad logistics that will be improved. And already, whether it's the firefighters and paramedics of our fire department, the staff from the relief organization CORE, the amazing medical personnel that are coming from all over our region, each doing different jobs at the vaccination site, making adjustments with our team to make sure those waits are as low as possible. And I've probably greeted a lot of you watching tonight as you've come in to either Dodger Stadium or arrived on the vaccine line. And I've seen this remarkable team reduce wait times, make it more convenient for folks who are in line, with public restrooms available to all patients, tents on site for when it rains. And we've improved our system of drawing the vaccine, maximizing our doses, and wasting nothing. We've brought on staff who speak multiple languages, added additional ADA parking spaces and restrooms, and the walk-up vaccination sites for those who don't have cars that are performing as well as Dodger Stadium. This is a huge logistical challenge. I've learned that leadership isn't about what you say, it's what you do, that logistics is leadership. And that's why we focused everybody on our city team and our partners into getting that job done, to improve the process, to fill those gaps, and to make it easier for everyone to get their vaccine when it comes. But I know you have a lot of questions, so let me try to answer some of those tonight. First, and the most fundamental, folks want to know, how do I find out if I'm eligible to be vaccinated? The good news is it's really pretty straightforward. You don't need to spend hours on the internet scouring for clues or worry that the next phase is going to begin without your knowledge. You can sign up for notifications and find out more by going simply to the county at vaccinatelacounty.com. Links to all the city-run sites are there as well. Right now, the vaccine is available to LA residents who are 65 and older, as well as healthcare workers, residents and staffs of our skilled nursing facilities, and the field staff and volunteers who have face-to-face contact with patients. And we're making real progress, completing vaccinations for all residents and workers of those skilled nursing homes that accounted for almost half of our deaths at the beginning of this pandemic. They have received their first shots, and today are much safer than they've ever been. The next group designated to be moved into vaccines in the coming weeks are workers in emergency services and food and education and childcare. Priorities that will help us open our schools more quickly, protect our grocery workers and others that are key to keeping our economy going, keeping us fed, and keeping critical services coming to us. And we need to do everything we can to make sure we get vaccines to them so we can open our schools up as soon as possible, so that we can safely move forward and allow people to get back to work because they don't have to worry about childcare at home. This week, the state said that in the future, vaccinations may go by age, that they may lower by 65 and less. And I just have a simple message to the state, to our federal partners: keep it simple, give us the flexibility, and allow us to make sure we are getting vaccines into those communities where people are dying disproportionately. Give me that freedom and give me those vaccines directly. As your mayor, I will ensure they're going to those neighborhoods that are the hardest hit. And that makes sense for all of us, whether we live in that neighborhood or not. Because if we can control where the virus is out of control, that means we're all safer in the city. If we can take those dense households where one critical worker is living with 2 or 3 generations and maybe a dozen family members, we can make sure that they are safe and that more people don't die, especially in our communities of color, where immigrants live, where African Americans live, those who have borne the brunt of disproportionate cases and deaths in this pandemic. That has to be a priority at every level of government. And stay tuned for more announcements on strategies to do that in this coming week. Either way, it's important to remember whether you qualify now or whether you'll qualify down the line. It may take a while to get through the current phase. We've got to get those second doses, when it's Pfizer and Moderna, because they require 2 doses, into the arms as well. And we will do everything we can to make sure that not only those second doses are there, but we continue to bring new people in for their first doses as well. There are issues that we're working with the Biden administration and the governor to resolve. Last week, I was very pleased to hear the president lay out plans this week to increase supply by 16% next week. That 16%, I guarantee you, we will get into the arms of Angelenos. Give us 50% more, 100% more, we can turn that around within days. And that can't happen soon enough. But we do know this: when the vaccines do arrive, the state and the county do give us the green light, we'll be ready to get those doses into your arms immediately. Second big question: if I've gotten my first dose, how do I make sure to get an appointment for my second dose? There are 3 ways to book an appointment in general. And let me just start there. One is through your medical provider. That's a doctor or a neighborhood clinic, a place that you're used to going already. And already some healthcare providers are saying, come on in. Come by Kaiser, come by this hospital, come by the community clinics, and you can get your first dose through a doctor. We hope to see that grow more and more. But second is to go to a government-run center and go to the government website, such as the one that I mentioned at vaccinatelacounty.com, where there's 198 places and counting that you can go for a vaccine. We know that appointments are tough to get, but they list them all there. Now it's nearly 200 vaccination sites. Now, for me, a lot of people can't go online. They don't have the internet connection, or maybe their age, or they're just not used to the technology. And that's why you can either go online or call. And if you need to call, the County Department of Public Health has set up a call center to help those seniors and folks with technology issues who need to have phone support to book their appointment, answer questions in multiple languages, and the city has deployed more than 60 of our disaster service workers to assist the county at that hotline. So let me give you that number, because it's easier, I know, for many people than figuring out how to go online. That number is 833-540-0473. That's 833-540-0473. And all of these roads lead to the same destination, an appointment to get vaccinated. Once you've booked your slot, just follow the instructions provided, bring your photo ID and your confirmation, show up at the vaccination site, whether it's a pharmacy, a hospital, or one of our centers, at the appointed time. And when it's your turn, the vaccine will be available to you free of charge, regardless of your immigration status. So let's get back to the second dose. That critical question, once I've gotten my first dose, how do I make sure I get my second? I shouldn't have pointed to my other arm. It's usually on the same side. If you've gotten your first dose at a city or a county site, you don't have to do anything. Your second dose appointment will be scheduled automatically. All you have to do is show up for that. If you're getting your vaccine at a City of Los Angeles run site, you'll receive an email and a text message 3 to 7 days before your second dose appointment. If you signed up by phone, we'll give you a call. We'll tell you where to go and when. Automatic second appointments will be booked for all of our patients and are guaranteed by LA County. So if you've already gotten your first dose, do not worry. You don't have to call us 12 times. You are already in the system. Your second dose is already in the system, and you'll be notified when the system works out the date and time in the coming weeks or days. Now, it'll tell you a day and a time, and while it is possible to change the appointment, we strongly recommend try to keep that slot that you've been given. And I want to encourage employers to be flexible. There's nothing more important for your employees than getting that second dose. So please give them the time to be able to go to a walk-up or a drive-up center, or to have that appointment with their doctors. But if you absolutely can't change that time, we will work with you and be able to give you an appointment to make sure you don't miss that second dose. We guarantee it. This is how we'll achieve the highest level possible, the protective immunity we need from COVID-19, and move us closer to the end of this pandemic. You know, even with so much time and attention rightfully paid to our vaccination effort, we're seeing some tentative signs of our progress. The numbers that are coming in, as you might have heard in the last few days, are very encouraging, but not so encouraging we should let our guard down. That's the truth. Good news, but not so good that we can suddenly relax everything we're doing. We had 6,592 new infections confirmed by the county today. This was a 3.4% decrease since yesterday. 2,595 of those were here in the city of Los Angeles. Today, we're under 6,000 people hospitalized. I say again, good news because we were at 8,000, but compared to where we were when we were down to about 1,000, it's still way above where we were just 2 months ago. But 5,855 people are currently hospitalized, also about a 3% decrease since yesterday. Of those, 1,503 are in intensive care units. This too is 1.5 times higher than just last month. And for every family hanging on, I know I have these conversations with too many families. And I want to thank those survivors of our lost, fallen angels who I speak to every single day, who share the stories of how wonderful their mother or their father was, of how they taught them everything that they know, of the work that they did to give back as a Metro employee or maybe a city employee. Everyday Angelenos who have been caught up in this. So while we celebrate numbers coming down, know when you make that decision to go out, to wear that mask, to distance, that you're doing something to protect even more families that are praying that their loved ones will survive. As always, like I said, this good news in this pandemic comes with an asterisk. Progress is very fragile, and the level of risk in our communities still remains very high. Even as hospitalizations are dropping, that number is still much higher than we want it to be. And Angelenos are still dying. The numbers that have not come down because they lagged for 2 or 3 weeks, our hospitalizations, are the number of people that we have lost. We lost 213 people in LA County, announced today. 73 of those lives here in the city of Los Angeles. And today we passed the tragic milestone of 16,000 LA County residents who no longer are alive as a result of complications from COVID-19. Perhaps the most serious threats that we continue to face are also the new and dangerous and highly contagious COVID variants spreading rapidly across the globe. We've identified some of them right here in Southern California that may account for the way beyond any model spread that we saw in December. So here's the bottom line about where things stand. We're now in a race against these variants, working to get people vaccinated faster than the new coronavirus strains can take root. And some of them may require us to continue developing or giving additional doses of vaccines that will help protect people, stopping them from causing even more harm in our city. We need to buy time. We need to slow the spread even further. And even as the state and the county update the safer at home order this week to allow for some modest business openings, including outdoor dining and personal care, we need to take additional steps to make sure we stay safe and healthy. The way we do that is to double down on what we're doing. As I said, we're all doing so much, and yet we can always do just a little bit more. It's not the time to start gathering in people's homes. It's not the time to ignore social distancing. It's not the moment to stop wearing a mask. If you've gotten your vaccine, that too is not a passport to party. This is the time to double down. In fact, Dr. Fauci said this week it's the time to double down on masks. Our president has said that too. And when LA became one of the first cities anywhere in this country and world to require masks back in April, the supply of medical grade masks and N95 respirators was very limited. And public health officials encouraged the general public to use cloth masks in order to keep those protected for our doctors, our nurses, our medical personnel who needed them the most. Now there's a lot more availability of these very safe and disposable masks, which have multiple tightly woven layers. They offer much more protection against droplets. And as Dr. Fauci said this week, if you have a physical covering with one layer, you just put another layer on it, whether it's one of those masks that has it built in or two that you can wear together. It just makes common sense and likely be more effective. That's why when I'm around others, I make sure that that mask can protect others, oftentimes wearing two when I was working on the line at Dodger Stadium. And as we work to protect ourselves against these more contagious variants, I want to encourage you to do everything you can to do the same, because these coming months will not be smooth sailing. There will still be way too much tragedy. These numbers continue to come. And like I said, we've become numb to the numbers. But they're not just numbers, they're people. They're families. They're stories. We have new challenges that we will face for our doctors and scientists. There's new burdens for working families across the city, even as I urge Congress to pass the American Rescue Plan now and unleash the $1.9 trillion in rental assistance, in child care assistance, in direct payments, in local government assistance, because we've been spending with our credit card to help folks with this response. Pass that now. And you can help too by using the tools we have to keep this virus at bay, not just your personal behavior, but signing up for a vaccination just as soon as it becomes available to you, not being scared of that vaccination, and lifting up our neighbors who are struggling the most. In 2020, you've shown your generosity. More than 12,000 Angelenos helped those everyday Angelenos who couldn't put food on the table or pay their rent We raised $66 million from you through the Mayor's Fund for Los Angeles. Things that went straight into critical relief programs, direct financial assistance for families, domestic violence rooms in hotels when our shelters were filled with families experiencing violence, meals for isolated seniors who couldn't cook for themselves, lifelines that reached 200,000 of our most vulnerable residents. And I'm so grateful to every Angelino who's dug deep to give, and I'm never going to stop asking to give a little more. Some folks have done well during this pandemic and have been able to survive financially, even thrive. So if you're able to, I encourage you to go to mayorsfundla.org. And even if you're pinched a little but have a tiny bit extra, every dollar makes a difference. Zero overhead, straight going to our most vulnerable folks here in LA. That better life that we seek is within reach, but it's going to require our collective brilliance and hard work and trust. So don't let up and don't despair. I know you're waiting till it's your turn to click and there's an open appointment. I know you're waiting for that help to come in, or for those hours to expand, or for the place that you work to reopen, or for a school where you can see your friends to once again be in person. But the power to beat back this virus, to resurrect the spirit of this city, has always been inside you. Not me here at City Hall, though I'm proud to work with 40,000 heroes that work for the city of Los Angeles. It's always rested in our collective hands, not our titles, but our actions, our decisions, our willingness to sacrifice so that we can reopen our businesses, get back to work, get back into school, and yes, embrace the family and friends that we miss. So that remains the case now. Let's keep it up and stay healthy, stay safe, and whenever you can, stay at home. Strength and love, Los Angeles. Thank you for all you're doing. With that, I'm happy to answer questions.
And our first question comes from the line of Dakota Smith from the LA Times. Your line is open.
Hi, Dakota. How are you?
Hi, Mayor. I have two questions.
Sure.
The first one is, can you walk me through the events of Monday in terms of how the city came to the decision to support the county's reopening of outdoor dining? On Monday morning at the LAPD press conference, you seemed to suggest that Newsom's order wouldn't ultimately lift the ban on outdoor dining, but then it appeared that it could, and then the county announced it was opening up, and then by the end of the day, your statement also said the city would realign with the county. So, what was that day like for you in terms of supporting that decision? And then secondly, how will the city be vaccinating people with disabilities, including those who can't wear masks or are in wheelchairs or are on ventilators? How will the city be helping those folks at Dodger Stadium and other sites? Thank you.
Thank you. So as I mentioned, we've already added some ADA features to both our walk-up and our drive-through centers. That's something that we'll continue doing. And we have a lot of good practice already because many people who live with disabilities are as we've just experienced, in our skilled nursing facilities and congregate care settings. So we will continue to build on what we've already learned to do, and oftentimes we'll have to go to them. So as I said, hold tight because we're finalizing some of the plans of this, but I hope that we have the flexibility to be able to, as I said, keep it simple and keep it flexible for local government. Ensure that we can make folks able to, at the local level, make those calls, find those decisions to make sure that it's not just by age, but it's by need. There's been this tension between speed and need, and I think that we can make those decisions best at the local level, so that if we are permitted tomorrow, there could be folks 65 and over and people with disabilities, or zip codes most impacted. When we have a limited supply, we would do a combination of things, offering some to seniors, getting into some of those neighborhoods where we see the most outbreak, and if we have folks with disabilities, we would make sure that we can come to them if they can't come to us. At the centers where many people living with disabilities can get tested, we're making sure we listen and adapt those to make sure that folks can get in there and can do that in a way that is accessible to everyone. In terms of Monday, that was just conjecture, and I think you probably experienced what I experienced and everybody watching experiences, which is these things change more quickly than you ever imagine. And I didn't expect it, but it came. We always are trying to align with the county. It does very little to have a patchwork county-wide of different regulations. Folks can go just across the street to a gym, just across the street to a restaurant, and either bring that spread back or just simply be confused. I'm trying to simplify things to make it easy for folks to understand. And so LA City, I think for the last 10 months, with a rare exception or two, we've always aligned with the public health advice and the orders of the county to make sure there's no confusion between what the city and the county are doing together. Thanks. Next question, please.
Our next question comes from the line of Ron Lin from Los Angeles Times. Your line is open. Please go ahead.
Hey, Ron. How are you?
Hey, Mr. Meyer. Thanks so much for taking our questions. One question for you today. In late November, you received a lot of criticism for backing the County Department of Public Health and its decision to ban outdoor dining. In fact, the LA City Council voted to oppose the county's order. Lawyers representing restaurants insist there is no scientific evidence that outdoor dining contributes to the pandemic. However, some epidemiologists say they have no doubt that the outdoor dining ban and the stay-at-home order blunted the third wave of the pandemic from tipping LA County into rationing health care. What is your response to people who want to ask the courts to take away the authority of government officials to ban outdoor dining to prevent a public health catastrophe? Thanks so much.
I think, look, the public health advice needs to stay with those public health entities that are charged under our state constitution and throughout this country with making those calls. That's critically important. To make those purely political decisions, we try to root this in what the evidence is, even when the evidence isn't clear. And so, I want to make sure that we always work with and listen to industries, whether it's the restaurant industry that I've spent a lot of time listening to and have some confidence, greater confidence now, of the ability for us to meet this moment. Because it's not just about the restaurateurs, it's about all of us going to those restaurants. Don't keep your mask off the 2 hours that you're sitting there. Make sure that you take it off when you're eating and drinking, not in between. There will never be 100% clear evidence, but I will continue to support our public health authorities and look at the other studies. You're right, there's plenty of evidence that it can. There's no place, by the way, with a virus where you can't spread it. I mean, obviously, if you and I are 50 feet away, the odds are almost negligible, but not zero. It's about minimizing risk. And right now, with numbers headed in the right direction, what we're trying to say is, gatherings are bad in general. Mixing households is bad in general. But if we do things in a safe manner, or as safe as we can, we minimize that risk. And as more and more people become vaccinated, we'll be able to feather that in. I don't want people to think, by the way, you get a vaccination and nothing changes. Why would anybody get a vaccination? Vaccinations are to make things better, are to make things safer, and for all of us to have an incentive and a reward for getting that vaccination, as we do with the flu, that we will have a better quality of life, we won't get sick, and in this case, be able to do more things. So while I respect, Restaurant Association, others who either sue or try to take that away, I think it's a bad public policy precedent to suddenly take away from medical professionals and others the ability to give that advice to the right policymakers, in this case the county supervisors, but I support their decision in December. I support it now too. Any follow-on, Ron?
Yeah, I mean, do you feel vindicated that you backed the public health department here? Because there was a lot of public criticism, about this, but in the end, the public health department was right that a really bad surge was coming. And I just want to know what you thought about that. Thanks.
Yeah, look, it's not a contest, and the last emotion I'll ever have is feeling vindicated, because it's not me against anybody that I serve. It's just trying to make the right calls on behalf of a city and the people that I love. I mean, I know as a mayor, I think there's going to be vocal criticism on every decision you make during something like a pandemic, and you just have to be able to be tough enough to absorb that, be sensitive enough to listen. I never dismiss those criticisms. I always spend time with those stakeholders and kind of listen to how could we do it better, and I often get good ideas that I can funnel back to public health. But it was the right call. Clearly, we did something right for something we still don't know that caused this surge way beyond any model that was projecting what would happen in December. It isn't, I remain convinced, Los Angeles didn't suddenly have 90% of people saying, woohoo, let's party and ignore public health. we were abiding by those things as well as I think we have throughout this pandemic. So I think it's a variant or just those holiday moments when there's a little bit more slippage that caused that. But if we hadn't done those things in the city, based on the county advice and what county orders did too, this would still sustain further, and we could have gotten to a New York level debacle where we would have had to get crisis care, where we would have had to ration care, and people would have died as a result because there wouldn't have been enough oxygen, enough beds, and other things. That's something I'll never feel sorry for having supported. Thanks, Ron.
Thanks so much, Mr. Mayor.
Next question, please.
Our next question comes from the line of Claudia Fasciuto from KNX News Radio.
Hey, Claudia.
The line is open. Please go ahead.
How are you?
Hi, you asked for 5 questions, so here they come. So, I'm sorry if I missed this earlier, but did you say whether any appointments will be opening up this week at the city site?
No.
2, you talk about not having a patchwork of guidelines to avoid confusion, so I'm wondering why the city has its own testing and vaccination programs instead of working through the county's system, and why the city wants doses sent to it directly. Do you think the city is doing a better job of managing this in the county? 3, following up on Dakota's questions about getting vaccinations to people who cannot make it to one of the sites, homeless seniors are especially vulnerable, and it's virtually impossible for them to get to a vaccination site. And you said during a recent briefing that you'd like to get into shelters. Skid Row service providers tell me they've been asking when at least their seniors will get vaccinated, and then nothing's happening. Why not? Number 4, during the December 21st briefing, Ron asked you when you might get vaccinated. You said you would not jump any queue, and we don't need every elected official getting a shot now to show that it's safe. I know your spokesman said you got a shot because you were at Dodger Stadium interacting with hundreds of people a day, but did you need to be the one doing that? Did you need to get a shot right now? And do you worry about how that will play with the public, especially after, Governor Gavin Newsom having, the meal at the French Laundry and things like that, hurting public confidence? Thank you.
Sure. Let me work backwards. No, quite simply, there was strong medical advice from the people that were there and what's offered to everybody that's working there. They said to minimize risk to the folks I'm interacting with and myself with the hundreds, if not thousands of people that I worked with and will continue to, because I'm going to continue working on site. I think it's really important when people do get that medical advice to say yes and to be example. Not to be an example because you're an elected official, but when that comes, we need people to know you should say yes and that you should feel good about this vaccine being safe, and I wanted to make sure that we did that as well. Second, on the question about the homeless seniors, absolutely. I want to be surging. That's why I want more flexibility. The moment you give us a green light, we will go and do a whole bunch of things that right now are not permitted by either federal, state, or county guidelines. And it's not the county actually who hits the green light on most of these. If you say to us that we do have that sort of flexibility, by the way, for all of our unhoused folks, we're going to be surging people into our congregate shelters. And right now we're drawing up plans. That's why I said hold on till next week. It takes some time to be able to go with our firefighters to places where we have homebound seniors, including homeless seniors, to be able to get those shots to folks who can't come to our sites right now. So those mobile teams, which are already working in our congregate settings known as skilled nursing facilities, will build on that. And I'd like to see us do that, by the way. I think it should be a high priority for all of our unhoused Angelinos, who very luckily, through a lot of hard work, a lot of visits, a lot of free masks, a lot of medical care out on the streets, still have a lower infection rate than people who are housed, but still have a greater vulnerability, so that if they are to ever have an outbreak on the streets that matches what those of us living indoors have, could be even more deadly than those of us that are housed. In terms of the guidelines, I think you might have confused two different things. I said the orders in terms of what's open and closed, those should be synchronous. But in terms of supporting, whether it's testing or vaccines, I think it's absolutely all hands on. Why would you not want to take advantage of all of the 88 cities and the county and the state and doctors and clinics and everybody getting as much in terms of vaccines into arms as possible? Same thing with testing. We are proud to be a very strong program, probably the strongest program run by a city in America, but really proud of what our county partners were doing too. And nobody's better. No, the county sites are doing great. They're also running at like 40 minutes to the line, same as ours. And I'm really proud. And the reason we've done it is not because we thought it was a good idea. The county's asked us to. The county asked us to look at that, allocated, and is guaranteed those sources, and we're helping because we have really well-trained people with our firefighters and our core workers. Most of them are not volunteers. They now have come on staff, and we're even talking about how we can help the county as they build theirs out, have more personnel, because I know nurses, for instance, and other clinicians at public health are staffing those, and if we can get them doing other public health work, we can hopefully replace them with some of the models we've pioneered together, like CORE and other partners as well. And in terms of the first one, it was about city sites. Oh, appointments at city sites. Yes, we are. I'll get you those numbers if my team can get me the numbers of what we're going to be opening up next week. It's all based on supply. Initially, we were only going to get 50,000 doses, but it's still significant, but a drop down from this week. So we're going to do 50,000. I've been lobbying the governor. I've been calling the White House. I've been talking to our county, and the county has been great with us, whether it's hospital doses that weren't being used, looking at some of our pharmacies, if there's anything that was unused, and they were able to increase that, I think, by at least 10,000. So I believe it's at least 60,000 appointments for our city-run sites. But many of those we've already put forward, knowing there are some that were coming in. We open them up as often as we get those doses in. Did I get to every question?
I think that's everything. And
Okay.
I might just throw out one more, number 5. Do you know anything about the new restrictions coming for outdoor dining? Because we still haven't seen the new order from the county.
No, I have not seen the county one, but I'll follow up with you and see if somebody on my staff may. I don't know, and I haven't looked at it personally, no, about the outdoor dining, but I know it starts tomorrow. Thank you. See, the 5th one's always the stumper. I should have stopped at 4, but thank you, Claudia. Next question, please.
Our next question comes from the line of Francine Kiefer from the Christian Science Monitor. Your line is open. Please go ahead.
Hey, Francine, how are you?
Hi, Mr. Mayor. I have a question about schools opening and unions, teacher unions. Dr. Farrer is saying now if the rates keep going on cases as they are now, that schools should be able to open in 2 to 3 weeks. On the other hand, teacher unions have a lot of concerns outside of what's happening with the rates, and it doesn't at all seem like they will be on the same schedule of what they want versus what, the cases rate says. So there seems to be a tension here, and how do you see that playing out?
So I've had a lot of conversations with my fellow mayors in California about this, with the governor, with our teachers' unions at the state level, and others. And it's a really important point. I think this should be our highest priority, that our children, especially those children who live in vulnerable communities, the old saying that I shared, I think, last briefing, that a child drops out of high school in 3rd grade, meaning that, for those 2nd and 3rd graders right now, you lose a year of learning and you may never recover. You may never graduate from high school. You may never go to college when you would have otherwise. We should be pouring everything we have into protecting them and to figuring out safe ways to open our schools. I agree with our unions. We shouldn't do that haphazardly without the testing there. I've been a big proponent of, for instance, the rapid antigen tests that give you a better idea of infectiousness in that moment than waiting a day or 2 for PCR tests. We're already piloting that with USC, have public schools here in the Los Angeles area that will pilot that with us for young people and those teachers. And I think we can show a model that works. USC is about to publish those results that we in the county have been a part of shortly, if they haven't already put that up this week. Second, my message to teachers' unions would be, hear you loud and clear and ask for the world, but set a bar and stick to that bar. Don't always just raise that bar up. I heard somebody saying that, the vaccine isn't 100%, it doesn't have 100% efficacy. Of course not. But we have, as a city, been running child care centers, 8-hour days, with city employees of various ages. You take those who are vulnerable and make sure that they are protected and not working in those settings. But we've essentially been providing a safe school-like setting for folks during this entire pandemic. So it can be done. Really challenge government to meet that bar, but don't make it an abstract bar that keeps going up every single time there's more added to that. Surge, as our president has said, the tests to our school districts, surge what we need to do with our campuses physically, surge what we need to do in terms of vaccinations, but then get ready to have a comfort of opening. And maybe you start with the very youngest children, as is permitted under waivers in Los Angeles County right now. But I really want to be a partner to our unions and to our districts to say, tell the state and tell the federal government what you need and help me be an advocate for it. And as soon as they give us, for instance, permission, as vaccines move up, as I said, the next group is going to be those emergency workers, teachers, education, childcare, and food. We should make sure that they are in line and that we do it in a systematic way so it isn't just random appointments. And I'm very heartened to see the district and others talking about the county, talking about using our schools as vaccination centers. The quicker we can do that, that should be the highest national priority. Any follow-up?
Thank you.
Okay, thank you, Francine. Appreciate it. Next question?
Our next question comes from the line of Asai Roca from LA Weekly. Your line is open. Please go ahead.
How are you?
Thank you, Mr. Mayor.
You bet.
Did the city ever make up for the 10,000 daily tests that were being conducted at Dodger Stadium? And has the testing site's closure had an effect on the daily cases we're seeing right now?
No. Luckily, if we had kept that open, instead of having about 6,000 unused extra tests a day, we'd probably have about 18,000 unused tests. So the capacity met the moment. It was a little bit of a gamble. I was nervous, and we surged extra tests just to make sure on our mobile teams. We had plans if we needed to open up a couple of other sites. But no, we saw a huge drop-off in demand. And to be clear, demand doesn't drop off because you close a center down. Demand is demand. That goes to the website, and people are there. And the fact that we have thousands of tests and capacity not being used each day means we're meeting the demands that are out there. And it was one of the first indicators I saw of our caseload coming down. Remember, where we're at today is still well above where we were most of last year. It's just in that toughest moment, we met the surge by doubling the number of tests. We're still above where we had started, let's say in around October, in terms of our tests every single day right now. And that is more than enough, as evidenced by the empty appointments that we have. Thanks. Next question. Oh, and by the way,
next question comes from the line of Joel Pollack from Breitbart News. Your line is open.
Hey, Joel.
Please go ahead.
How are you?
Hi, Mr. Mayor. Fine, thank you.
Good.
City Council member Kevin De Leon had a bit of a difficult week when he stumbled on the words of the Pledge of Allegiance a couple days ago. And it was sort of a humorous moment, but it came the same day that President Biden criticized the 1776 Commission, which was President Trump's effort to address civic education. What is your view on the 1776 Commission, and do you think that we need a revival of a common American civic culture in LA and in general?
Well, that's a big question. First of all, we've all been where Councilmember De Leon was. Trust me how hard these jobs are, and sometimes I forget the name of my best friend. So I got his back on this, and that was just a moment where your brain freezes up. I know he knows this Pledge of Allegiance. I know the Pledge of Allegiance. You know the Pledge of Allegiance. Every person who goes to school here. And that was just, I think, the exhausting hours that we're seeing him, his colleagues, and everybody else do. So, yeah, it might have been a humorous moment, but he's a great elected representative who has been one of the most patriotic people I know in this country. Second, in terms of education, sure, I absolutely believe in civics and history. But I think it's important for that to be a robust history, right? And some people sometimes write that in an ideological way, that these are the only people who built this country. And I do lift up the founding mothers and fathers who built this country. But oftentimes the women that were there are written out of it. The African Americans who were slaves, who fought for their own freedom, are kind of forgotten, and Abraham Lincoln is the only person in that story as critical as he was and as heroic as he was. So absolutely, I would embrace the idea of, I do think we need to have one nation, but we're in this wonderful moment where people are recognizing things like, right now, the land I'm standing on right here on the City Hall is where the village of Yanga was, the place of poison oak in the native was Tongva language right here. And I like to know that history, I want to know that history. This year is the 150th anniversary of the biggest lynching in American history, 2 blocks from here, when Chinese Americans were lynched because of a mob that decided all the Chinese that were here were responsible for gunshots that came from a few blocks away from here. We need to know the good and the bad. We need to know the folks that were written out and the truth of those that are written in. As long as that's done 100%, I do think that we need to have kind of a common opus that we can come to, that we can know the struggles we've had, the challenges we've overcome, and yes, the heroism that is all around us. It shouldn't just be a history of bad things that happen. It has to be those amazing moments. We've got a lot to celebrate, a lot to learn, and I would welcome that at the national level. But I don't think the two things that you connected are connected. Just a long day for a friend. Thanks, Joel. Next question, please.
Our next question comes from the line of Ron Lin from Los Angeles Times. Your line is open. Please go ahead.
Second dose, Ron.
Hey, Mr. Mayor, just to follow up to Claudia's question. When you got the shot, how did the shot feel, and did you have any side effects like fever or soreness? Thanks.
No. You kind of feel like you've worked out pretty hard on your shoulder the next day, and the next day can't feel anything from that soreness. No side effects, nothing else besides that. So not only was safe, I've had flu shots and other vaccinations that felt worse than this one. You are a little tender there, but no, I was able to continue working, went back and continued my work as mayor and have continued working at the site as well since. So I encourage people, when your time comes, please take advantage of that, get the vaccine. And we've already seen, by the way, here's a thing I didn't share, that I think you guys might have talked about it, or the fire department put it out there. We've seen even with over 50% now of our firefighters having received the vaccine, the number of cases in the fire department have gone down greatly. So I encourage those firefighters who haven't, get that shot too. You can now see the evidence of how safe it's been, and your buddies around you who have been able to in the firehouse get themselves and their families protected. And we see also the impact that it has reduced the number of cases in a set population. We should all follow that example. Thanks, Ron. All right, I'm told that it was the final question. As always, I'm going to go into Spanish, and I want to thank everybody who's tuned in and stayed tuned in if you're still with us. We'll see you soon at a briefing very soon. Continue doing all those things, and I appreciate so deeply what you are doing to make sure that more and more sunlight comes through even in these dark days. With that, hola Los Ángeles, muy buenas tardes. Hace un año vimos el primer caso de un nuevo coronavirus en el condado de Los Ángeles. Desde ese día, nuestras vidas han cambiado. Hemos sentido pérdida, dolor, y hemos contribuido al esfuerzo histórico para salvar vidas y derrotar esta pandemia. Esta noche les informo sobre el tema que está en la mente de todas, las vacunas. A partir de hoy, la ciudad de Los Ángeles ha vacunado a 152,612 personas. En los últimos 3 días, nuestros sitios han proporcionado 34,850 personas con la vacuna contra el COVID. Y cuando el estadio de los Dodgers haya aumentado su capacidad, podremos vacunar al menos de 12,000, al mínimo, personas al día, solo en ese lugar. Y tenemos 4 más sitios en este punto. Este es buenas noticias para toda la gente en Los Ángeles. Y he estado trabajando en el estadio de Dodgers juntos con nuestros bomberos y paramédicos, personal médico y de la organización CORE para determinar cómo podemos mejorar el proceso. Reducimos los tiempos de espera, instalamos baños públicos y tenemos carpas listas para la lluvia. Mejoramos nuestro sistema de extracción de la vacuna para maximizar las dosis y reducir el número de dosis que quedan de sobra al final del día. Este es su ciudad, trabajando muy duro a proteger su vida. Además, contratamos personal que habla varios idiomas y agregamos más estacionamientos y baños para acomodar más personas con discapacidades. Cada día estamos trabajando para mejorar el proceso y entiendo que muchos tienen preguntas. Empecemos con lo más básico. ¿Cómo puedo saber si soy elegible para recibir la vacuna? Es muy fácil. Visite vaccinatedcounty.com. Llene detalles de su empleo y edad y el condado se pondrá en contacto con usted automáticamente cuando sea elegible para recibir su vacuna. Ahora la vacuna está disponible para residentes de Los Ángeles de 65 años o mayores, también los trabajadores de salud, residentes y personal de los centros de enfermería especializada y el personal y voluntarios trabajando en el frente de la crisis. Y estamos avanzando. Completamos la distribución de las vacunas para todos los residentes y empleados en los centros de enfermería especializada. El siguiente grupo designado por el condado en estas próximas semanas son los trabajadores en centros de educación y cuidado infantil, en servicios de emergencia y en alimentación y agricultura. Esta semana el Estado dijo que quizás en el futuro se determinarán vacunaciones por edad, pero ahora solo es los trabajadores médicos y estos residentes con 65 años o más. Esta semana estamos siguiendo el proceso del Estado y cuando se finalicen los detalles compartiré esta información con ustedes cada noche durante estas conferencias. Sin embargo, todavía no sabemos cuándo pasaremos a esta próxima fase, ni cuándo recibiremos más vacunas. Pero estamos trabajando con la administración Biden para resolver estos problemas y me alegra saber que tienes planes para enviar más. Estamos listos, pero necesitamos más vacunas. Pero cuando lleguen, estaremos listos para ofrecer las vacunas a angelinos inmediatamente. Ahora, la segunda pregunta. Cuando sea elegible, ¿cómo puedo hacer una cita? Hay 4 maneras de hacer una cita. Puede hablar con su médico o lo puede hacer en nuestra página web coronavirus.lacity.org/vaccine. Pero es más fácil el sitio del condado vaccinatedlacounty.com. Y también lo puede hacer a través del Estado también, pero si no tiene acceso al Internet, llámanos a 833-540-0473, en línea, por teléfono o con su doctor. Y la última pregunta importante, una vez que tenga mi primera dosis, ¿qué hago para recibir la segunda? Si recibió su primera dosis en un sitio de la ciudad, como Dodger Stadium, o del condado, como el Forum y Magic Mountain, no tiene que hacer nada. Su cita para la segunda dosis se programará automáticamente. Usted recibirá un correo electrónico y mensaje de texto entre 3 y 7 días antes de su segunda cita por los sitios de la ciudad, indicando a dónde ir y cuándo. La segunda cita puede ser en un lugar diferente al primero, pero se programará dentro del tiempo recomendado por el CDC. Y nosotros tenemos citas en el mismo sitio de su primera dosis. Se reservarán segundas citas automáticas para todos nuestros pacientes. Entonces, si ya recibió su primera dosis, no se preocupe. Su cita de segunda dosis está en el sistema y se le notificará su fecha y hora en los próximos días o semanas. Aunque tiene la opción de cambiar la hora de su segunda cita, le recomendamos que mantenga su cita que tiene y le pedimos a los empleadores que le permiten a sus empleados tomar el tiempo para ir a su segunda cita. Es muy, muy importante. Hemos visto algunas señales indicando que estamos finalmente progresando en nuestra lucha contra este virus. Hoy hay 6.592 nuevas infecciones en el condado de Los Ángeles, 2.595 en la ciudad. Hay 5.855 personas hospitalizadas con COVID-19 y 1.503 pacientes están gravemente enfermos en nuestras unidades de cuidados intensivos. Pero estos números son un nivel más bajo que en las semanas pasadas. Los angelinos siguen muriendo de este virus y estos números son trágicos. Hoy perdimos otros 73 vidas en la ciudad de Los Ángeles y 213 en el condado. Y ahora nos enfrentamos con las nuevas variantes de COVID, que son altamente contagiosas. Necesitamos continuar nuestras acciones, a proteger nuestras familias, nuestros vecindarios. Y entonces estamos en una carrera para evitar que causen más daño en nuestra ciudad. Tenemos que evitar la propagación. Mientras que el Estado y el condado actualizaron los órdenes de salud pública para permitir más actividad económica, como nuestros restaurantes, tenemos que tomar más precauciones para quedarnos seguros y sanos. No se reúnan en las casas de otros y mejoren sus esfuerzos para mantener la sana distancia. No dejen de usar la mascarilla. De hecho, ahora es el momento de doblar las mascarillas. Ahora, cuando estoy con otra gente, llevo 2 mascarillas. Una es descartable y luego uso una de tela encima. Los animo a hacer lo mismo. Los próximos meses traerán más dificultades, pero usted puede ayudar con registrarse para vacunarse tan pronto que esté disponible para usted. Y con donar, si puede, para ayudar a nuestros vecinos que necesitan apoyo. Si puede, lo invito a donar al mayorsfundla.org, mayorsfundla.org, para dar ayuda en efectivo para familias que necesitan su ayuda, personas sin hogar, por comidas para los ciudadanos mayores o más, inmigrantes especialmente. Tenemos un mejor futuro cercano. No se dé por vencido, no se desespere cuando tenemos el poder para terminar esta pandemia. Pero gracias a ustedes por su trabajo, por su visión, por su amor de esta ciudad. Quédense seguros, quédense en buena salud y cuando pueda, quédense en casa. Fuerza y amor, Los Ángeles. Gracias and good night.